This is Your Partners in Pain, a podcast that aims to bring together those who live with pain, healthcare providers who treat chronic pain, and researchers working on topics that affect people living with pain. This podcast is a must-listen for anyone experiencing pain or anyone trying to help those who live with it. Your Partners in Pain is presented by the Saskatchewan Pain Society, also known as SaskPain, and I am your host, Alexandria. Each episode, we are going to speak to Saskatchewan-based healthcare providers and researchers who have information and education to share about pain science and pain care. We are also going to speak with everyday people as they share their incredible stories of living with pain and the techniques they've used to help manage it and live well. It is important to note that the information presented in this podcast represents the opinions of the host and the guests that appear on the show and not that of SaskPain. The content presented should not be taken as direct healthcare advice, but for informational purposes only. Because each individual is unique, please consult your healthcare provider for any questions or concerns you have, or before you incorporate any of the ideas presented in this podcast into your own treatment plan. Today, we are speaking with Dr. Donelda Gowan. Donelda is a trained massage therapist. She holds multiple degrees in psychology, has a Master's of Science in Epidemiology, and a PhD in Population Health. She is currently the Associate Director of the Center for Integrative Medicine in the Department of Community Health and Epidemiology within the College of Medicine at the University of Saskatchewan. She has recently retired from massage therapy after 35 years of practice, and today Donelda is going to provide education on what integrative medicine is, the benefits of massage therapy, and also the importance of utilizing massage as a bridging therapy for those who are living with chronic pain. So Donelda, thank you so much for joining us on Your Partners in Pain today. We've been trying to make this episode happen for a while now, so it is so great to finally have you here.
Well, thank you for inviting me. I am so happy to be on your podcast.
I first met Donelda after I had attended a number of lectures at the University of Saskatchewan at the Center for Integrative Medicine, where she is the Associate Director. If you aren't familiar, these events have a variety of researchers or everyday people who come and speak to unique perspectives in health and wellness. And Donelda always does an incredible job of finding the most wonderful guests. I always learn so much in that 1 hour period. But Donelda, would you tell us a little bit more about what goes on at the center and perhaps give us an explanation or definition of what integrative medicine is?
Yes, I'm happy to. The Center for Integrative Medicine is an academic unit in the Department of Community Health and Epidemiology in the College of Medicine at the University of Saskatchewan. And as you mentioned, one of the things that we do is host the Integrative Health Seminar Series. And prior to the pandemic, these were grand round sessions in RUH, in the Royal University Hospital. And then we started using the Zoom platform. And I want to mention also that everyone is welcome to attend. And as an academic unit, we really focus to facilitate knowledge transfer and exchange. And we see ourselves as a hub for academics and clinicians and students, and of course, persons with lived experience who are interested in whole systems or whole systems health and healthcare. And we work really hard to connect people and fields of study and to create learning partnerships between the university and the community, and with a focus on the integration of the topics of healing and wellness. So that was kind of a long answer, but that's what the center is about. And now you also asked me about integrative medicine, and if I could say more about that or define that term. And it's a great question. I think one could look at how to define integrative medicine or integrative healthcare in a variety of ways. And I think one way that is commonly described is that integrative medicine is the coordination of evidence-based care drawn appropriately from conventional approaches. And conventional approaches would be things like medicine or rehab, psychotherapy, surgery, those types of biomedical approaches, but then also less conventional approaches. And those less conventional approaches would be things like traditional or complementary integrative medicine. TCAM is a common abbreviation for that. And lots of people will be familiar with examples like mind-body approaches, such as meditation or mindfulness. But, it could also be really large medical systems that describes. So things like traditional Chinese medicine or functional medicine, and of course, body-based therapies and methods like massage therapy. But it strikes me also there's another way to think about it, another way to look at what integrative medicine is, or what we might say more as integrative healthcare in sort of a finer lens, is that in the really big picture, integrative health really focuses on an awareness of the whole person. So now you have great expertise in this as well, in terms of the ecological perspective on health, and that integrative healthcare should stress the importance of all the levels of influence on health. And we certainly know from population health and epidemiology, the social determinants of health speak to all levels of individuals and families and communities and populations, and even the planet's health, really, right? And so I think that might be a familiar emphasis that people would think about, that biopsychosocial or even that biopsychospiritual interplay in health and illness, and even the broader impact of the environment on individuals' well-being. So that sounded like a fairly long answer to your question, but it's a very broad topic area, and authorities and sources will vary in how they define that term.
That is all really, really fascinating. And I'm going to make sure that I include some links so that people can connect directly with the center. But that really holistic approach where we are looking at the individual and the social and environmental, the global level, the local level, it's all so essential for overall well-being. Donelda, you have a massive amount of education, which I spoke to during our introduction, but your background is actually in massage therapy. Would you be willing to tell us a little bit more about your personal story and how you ended up as a massage therapist?
Well, I am happy to do so. And my story of becoming interested in massage therapy as a field, as a career, began for me just way back in high school when I was a teenager. My mother fell and broke her arm, and her very forward-thinking GP in Owen Sound, Ontario, at the time referred her to an RMT, a registered massage therapist. And the thought was that the massage therapist could help with some of the shoulder pain and neck pain associated with the fracture, because she was in a sling and she had stress and it was traumatic in terms of the injury, and he just thought that that would be a good place for her to have some care. And honestly, Alexandria, that was the first time that I or anyone in my family had ever even heard of massage therapy. So I was quite intrigued. And then I also have to be completely honest in telling my story of my career path. I was a 17-year-old high school student, and I remember being very much drawn to the length of the program. It was 2 years of college versus long, long years at university, and I was so very anxious to get to adulting, so that was one of the other draws.
I totally understand that as a student right now. So you made a great choice.
Well, and as you know, the years go by and the schooling becomes quite enjoyable as well. And it all fits together. And it's been a fascinating journey within this field in massage therapy, and decades later, I'm still so interested in massage therapy and how it fits within healthcare in Canada and in North America and in the world. And of course, I'm fascinated by others' expertise, and you as a sociologist have so much of the medical anthropological knowledge that I think we're just really scratching the surface of understanding how we can learn from history and sociology in terms of doing better at helping people with their healthcare issues. And so, it's challenging in terms of massage therapy and thinking about it in relation to research and education and practice, because it's touch, right? Human touch. It's a skilled, applied human touch. And there's certainly still barriers faced to providing health-based, skilled physical manipulation within healthcare. And it's interesting to me because we certainly accept from primates, from animals, that caring touch is critical for health. And from psychology, we know this, and from zoology, we know this, and yet we struggle sometimes to accept that this is part of appropriate and legitimate strategies to provide care for people here. And you asked about, how did I get into the stream, into the profession? And I really think that outsideness, we value physiotherapy and physical therapy, but massage therapy is just a little bit outside of mainstream. And I will say that is probably attracted me right off the bat, because I am by nature curious about novel ways of being and doing, and I like helping people, and massage therapy was a great fit for me.
That makes total sense, and that active connection is so important, which is why on this podcast, whenever we can, we always try to encourage people to be reaching out for social support whenever possible. But I love your perspective on just how much we know that physical touch can do a great deal for wellness. And as a pain patient myself, I have always gone for massage therapy, and it's always made me feel better. But switching gears a bit, I found in my time working alongside people in pain care and pain research that there are so many different pain diagnoses that exist, and so many of them are resistant to conventional treatments like medication or physical therapy. And in some of those cases, often there is absolutely no structural problem to be found to explain someone's pain. I'm thinking about things like fibromyalgia, which we know is a sensitivity closely linked to the nervous system. But a lot of people report benefits after going for a massage, as I just did a moment ago. So I guess what I'm wondering is, does that have to do more with how relaxed you can feel while you're getting a massage, do you think? Or is there something happening, at that tissue level when you are working with and manipulating it in a way that has positive benefits for your body in terms of, increased mobility or blood flow or flexibility, as well as just feeling really good for the nervous system? Or maybe it's both. Maybe we have no idea. It seems so complex at this point.
It is indeed complex, isn't it? And yes, I think what your question points to, if there was a simple answer or a great answer to a complex question about what's the mechanism of action regarding massage therapy, how does massage therapy help? And I'm sorry to say that I don't have a simple or really great answer, because by definition, massage therapy is the skilled physical manipulation of soft tissues in the body. And so we often think about the the physical input to the organism and the resulting outcomes. And so the mechanism of action question is a little bit infamous in my field. And I say infamous because massage therapy is a very old therapy, and it is frequently used. In fact, massage therapy in Canada is the most used of the insured non-medical health services. And so it's used by millions of Canadians. And yet, as an area of research, that mechanism of action, or that how does it work, is still a novel question for which we don't have great answers. And as you suggested, there's varying hypotheses, but the area of research of testing theories of how massage therapy works is underdeveloped. And there's even perhaps even insufficient interest in studying or supporting how massage therapy relieves pain, because it's much more broadly applied in terms of the whole person, as opposed to something like a pharmacological agent, where we're able to administer a standardized dose of some sort of a drug and run a randomized controlled trial and sort people according to the outcomes. But I can tell you, even though there hasn't been a great deal of research on the how massage therapy works in terms of pain, there has been a pretty solid exploration of the what are the outcomes. And I wanted to share with you that there was a recent meta-analysis, a large systematic review with meta-analysis, and as you know, that's a large or a number of studies that are combined together, and the data is pooled in order to be able to say something more concrete about the findings. And in 2021, author Crawford and others were able to conclude that based on the evidence, massage therapy should be strongly recommended as a pain management option. So we often do hear from various factions within healthcare that there's not a lot of research to support massage therapy. And I think that's not an accurate representation. In fact, massage therapy has been the subject of more than 300 clinical trials and dozens of systematic reviews specific to the topic of massage therapy and pain. So while I say it's how it works is not well researched, it's support and the recommendations that people can make either to refer individuals for massage therapy or to seek massage therapy themselves has a pretty solid evidence base, and I just wanted to share that with respect to decreasing pain, increasing mobility, and some function, I think it's very reasonable to think of massage therapy as an appropriate bridging therapy, even a way of easing discomfort and helping people with activities of daily living so that they can get on with the activity of daily living.
Absolutely. And a bridging therapy, that is such a great term and way to think of it. I actually had no idea that so many people even went for massage. So I'm going to see if we can get that statistic for the show notes if anybody is interested to do their own research on that. But I'm thinking out loud a little bit here. And I feel like a lot of people would rather just take medications to try to manage their pain as opposed to going for this type of regular treatment. They've got to leave their house. They've got to make just another appointment. But I'm wondering if you have any advice or insight for patients who may feel apprehensive starting a massage therapy routine, because for some people, going for a massage could be painful if they're already experiencing a lot of physical pain as is.
Yeah, that's a really, really important topic, and one that I'm really glad that you brought up. It's a big question for what people should consider, and I want to share that massage therapy safety was the topic of my doctoral work. So, in response to this whole line of questioning, I want to say that I agree with you, and I understand. Oftentimes the impetus to move towards medications. I do understand that in terms of when we're not feeling well, we want relief, and we're seeking whatever strategies are most available to us and are most familiar and are most supported. And so you're right that oftentimes, when we're struggling with something, it's an additional burden to try new things or to try novel things. And I just want to say that compared to the risks of medication, I think we all reasonably understand that compared to the risk of medication, something like massage therapy, risk of adverse events occurring is low. But the results of my own research suggest strongly that this is true, provided that the massage therapy is given and provided by a trained and skilled practitioner, because there are risks. And particularly, as you mentioned, Alexandria, people with complex issues, complex pain issues, massage therapy absolutely must be applied judiciously. And, your point about pain, or your question or query around things being painful, I'm going to argue, and people might disagree with me. So I want to say this is one point of view, but I'm going to argue that for massage therapy to be therapeutic, it shouldn't be experienced as a painful stimulus. Right. So if we wanted to be really particular about that, you will know as well as anyone, and better than many, that pain stimulus by definition is something that is unpleasant. So I'm going to suggest that, is that really what we mean when we say that it could be painful? And perhaps that's splitting hairs, but I just want us to really think carefully on that, because of course I appreciate that sometimes people say that massage can hurt so good, but I'm going to tickle that a little bit and say that if it feels good, is it really pain? By definition, is it pain? And maybe at the end of the day, the important thing is that ultimately we want people to be guided by listening to their own bodies. It should feel like it's helping. I guess that's what I will say also, Alexandria, is that it should feel like it's helping, and each individual should be able to discern that for themselves, because I know there will be exceptions whereby massage therapy would be considered necessary procedural pain, right? And anybody who has a history of access and experience with health and healthcare knows that there's procedural pain, things that we go through in order to be feeling better. Burn care would be a really good example, right? Where oftentimes things like soft tissue manipulation of the tissue is painful in the process of increasing extensibility or increasing the mobility at joints. But I want to be clear that with respect to massage therapy for the management of pain, I think we really need to be precise also when we're speaking of different types of pain and or other kind of health conditions with associated pain, and the appropriate approaches within massage therapy. Because just like the healthcare side of that, or the health side of that, when we're talking about pain, you are a pain expert, and as you said in your question, that there's so many different diagnoses. Well, similarly, there's going to be a lot of different approaches with massage therapy, and we would want to be dealing with someone who is knowledgeable and experienced and skilled, that's able to apply that judiciously, as I suggested. And so I'd encourage anyone with pain considering massage therapy to be truly empowered to communicate your needs and your individual response to the treatment to your massage therapist. And a skilled and a knowledgeable RMT will be able to make a treatment plan along with the person seeking care. And they will also be able to tailor an approach that's really specific to each individual's needs, and then assess those outcomes, and then monitor the progress and reassess where necessary and go in the direction. And that's where I see massage therapy fitting into the integrative healthcare model, is that partnership between the practitioner and the patient, the individual receiving care, is of paramount importance. It is to be a joint venture with decision-making made together.
Those are all really important points to consider, and you bring such a great perspective, especially on that empowerment piece. So thank you so much for elaborating on that. However, if somebody is interested, how do you find the right massage therapist? If you are going to go online right now and maybe Google massage therapy Saskatchewan, there are so many people and places that pop up. And there are also so many different types of massage available, which I think makes it a bit overwhelming for people to even get started if they want to.
Yeah, absolutely. I totally agree. And it's a great question. And I want to say again that I think it's essential for safety. I'm so aware of the vulnerability around having a chronic condition like chronic pain. It is critical to find a massage therapist who's qualified to work with people with health issues, including pain. So in this question, my simple response would be, my recommendation would be to use the Find a Therapist directory on the Massage Therapists Association of Saskatchewan website. And that directory is set up really well so that you can search by city, but then within each therapist that's listed on the directory, they should have you should be able to find some information about their qualifications and their interests, and perhaps some of their advanced knowledge. And that could include knowledge in working with individuals with chronic pain and even with complex pain types of conditions. So that's my recommendation, is to find a therapist on the Find a Therapist directory on the Massage Therapists Association of Saskatchewan website.
Excellent. I will make sure that we throw that link into the show notes so we can get people on the right path if they feel so inclined. But Donelda, would you like to speak to anything else that we haven't discussed yet today?
Well, because I know something about your area of expertise, I feel like you and I would love to speak with you about how your knowledge could inform what people might consider in terms of massage therapy and pain. But that's a conversation we may have to have another time, because I know that it could be just a really rich discussion. And the reason that I'm so interested in the medical anthropological or the sociological aspect of this is that we often think about chronic pain in how we can empower people to help themselves. And I spoke at when you asked me about my own interest in massage therapy as a career and as a part of healthcare, and I'm a health services researcher, so I'm interested in how these things fit together within our systems, and particularly for issues of chronic pain. I find it so interesting that massage therapy might be often overlooked, and I certainly in my career, we and my peers, I'm sure, listening, my massage therapy practitioner peers will often, have this response that, well, massage therapy, maybe doesn't really do anything. It just makes people feel better. And my peers and I, will often be so perplexed when we hear this, because we often wonder, what are other healthcare providers trying to do for people? Because we wonder what else there is there. Of course, we're trying to help people feel better. And so, I think it comes down to sort of an interesting there's sort of a couple of ways of looking at these effects and how this can help with chronic pain and with other sort of health issues. And perhaps it sits in that mind-body realm. Maybe it sits in that mind-body realm, because I always say that after massage therapy, I always feel like the world is a kinder, gentler place. and that's quite a profound effect. And maybe that's that mind-body experience of that type of caring, skilled touch. Or maybe it is more reductionist. I can certainly share that one of the seminal papers in the field in massage therapy research was a meta-analysis way back in 2004. And the researchers found that the decrease in anxiety and depression were, in fact, massage therapy's largest effects, with a course of treatment providing benefits similar in magnitude to psychotherapy, like a 75% reduction in trait anxiety and depression. So I find that very interesting. And I just wanted to share that with listeners of your podcast in terms of where does massage therapy fit for people with chronic pain. And I may not be providing so many answers as additional questions.
No, that is such a wonderful overview. And as you were speaking there, then of course my gears started turning as well. And, if we do want to think about this from that anthropological, sociological line of thought, as opposed to the purely biomedical material, what is happening on the physical level? I know just based on anecdotal evidence and, my own personal experiences, is that role of social connection is such an important piece. I think about when I was having chronic pain in the middle of COVID, and I would go and see my massage therapist every week. And she was just really that outlet who was not only physiologically making me feel better, because I had tons of muscle guarding that was happening. My muscles just wouldn't release because I was anxious and because I was super tense. But I'd lay on her table for a massage for, 60 to 90 minutes. And I would usually end up passing out immediately because my nervous system was so ramped up. But when I left that massage at the end, my breathing had slowed down. I felt so much calmer. And it really is that bridging therapy that can help you get to the other side of being able to get active again, or, have somebody who understands chronic pain and is supporting you, but also just making you feel good. So, we could have a conversation back and forth about this, I feel like, for probably 2 hours, but you've provided such an incredible wealth of knowledge with us today. And I'm so glad that we could speak to you about massage therapy, Donelda.
Well, thank you. And I agree. There are so many facets to this conversation, but I totally appreciate the opportunity to speak about this one, even small overview. And so thank you so much for asking me to contribute. I'm grateful.
Thank you again. But because this is a Saskatchewan-based podcast, we always ask our guests this one simple question: if you would be willing to tell us about one of your favorite things about living here, or perhaps you have a favorite place that you love in the province.
Oh, I love the province in its entirety. I often think that there's a topography that naturally feels like home to people. And for some people, that's the ocean, right? The ocean soothes their soul, as we say. Or for others, it might be the forest. That's their happy place. Or it could be the desert for some. But, for me, it's the prairie. And I love the sky. I love the expansive horizon. To me, the prairies of Saskatchewan fuel my imagination. I typically imagine myself on horseback, galloping over the next gentle rise. And I love the flatland of Saskatchewan. And of course, we don't have oceans, but we have beautiful lakes, and we have desert, and we have forest, and we've got lots and lots of beauty in Saskatchewan to inspire. And I'm always grateful that this is where I live.
For sure. Well, and it's quite nice that we do have that range of landscape. So it only takes, a little while to go and see something a little bit different. But that was such a great image to leave with us. And we often speak to how important getting out into nature can be, it does wonders for the mind and the body. And we also know even just looking at imagery can improve our mood and release those feel-good chemicals if you have a limitation that makes it so that you can't actually get outdoors. But again, Donelda, thank you so much for taking the time to speak with us. And I'm going to make sure that we get all the information we can so that people can come and learn from the Center of Integrative Medicine. And maybe they'll find some more, practitioners or researchers or people with lived experience to give them some more skills and resources that they can put in their own toolbox.
Alexandria, it was a pleasure.
As mentioned during the episode, we have included some important show notes for links to information on the Center for Integrative Medicine so that you can attend some of those very informative seminars, as they are open to anyone and everyone. We have included some statistics and research regarding the benefits of massage therapy, as well as a link on how to find a massage therapist here in Saskatchewan. As a pain patient, I am personally partial to myofascial release massage therapy, which really qualifies as that hurts so good type of massage that Donelda mentioned, but there are a wide array of resources to see what the best form of massage may be for you and your condition. Lastly, we are very near the end of our season, and we are looking forward to sharing our last 2 special guests with you this September. Thank you for listening. Thank you for listening to Your Partners in Pain, a podcast for people experiencing pain and those who help individuals living with pain. Funding for this podcast was provided by the Saskatchewan Community Initiatives Fund and the Saskatchewan Pain Society. For more information about our organization or to find additional resources, please find us on social media at SaskPain or visit our official website, www.saskpain.ca.